So, as we know, when we start taking history from the patient, we start usually with taking the personal history. And obviously you have to know the name of the patient has to know the name of the doctor, because this would establish the physician-patient relationship, which is very important to get the patient trust and confidence. The first important question in personal history that would actually be significant in peripheral vascular disease is age. We know from pathology that with advanced age, the possibility of getting atherosclerosis and peripheral arterial disease is higher. So the age is very important. We know as well from pathology that male gender is more prone to get atherosclerosis in comparison to females. About profession, this is a crucial question. You have to remember always that when we treat patients, we are trying to improve their quality of life. We are not just treating diseases. So if you meet two patients, one of them is 85, he can walk for 50 meters, then he gets intermittent claudication in his right leg. And another patient who is a postman who is 52 and he gets intermittent claudication after he walks for 500 meters. If you just think superficially, you might think, okay, the patient who can walk 500 meters actually walks better. So the patient who walks 50 meters has to get my attention more than the patient who is walking 500 meters. But actually you have to analyze how much the claudication is affecting the patient quality of life. So profession and quality of life and how the patient walks and how the complaint is affecting his profession is very, very important. As regard the address and where the patient was born, these questions are very important if you are actually trying to find if there is any specific pollution, if there is something endemic in an area, but it has no direct effect in peripheral arterial disease or atherosclerosis. The race as well is not a big issue in peripheral arterial disease, but we know from literature that Black Africans actually have higher incidence of atherosclerosis and their vessels are more difficult to treat. As regards sexual history and marital status is important in males because as we know that atherosclerosis, when it affects the aorta, the common iliac or the internal iliac arteries, it would affect the penile circulation, which can cause impotence. There are different causes of impotence. Not all impotence are because of atherosclerosis, but this is an important question if you are taking history from a male. As regards the menstrual history for females, it's important to know if the patient is menopausal or not, because female patients will be more prone to get atherosclerosis if they are postmenopausal, while the female patients in the childbearing period are less prone to atherosclerotic process. As regards pregnancy and contraception, it has no direct relationship with peripheral vascular disease, but just for formality, you might need to ask the patient about her previous pregnancies, and if she's taking any contraceptive pills or not.